as always, I want to just remind everyone that
Sherry.
this is being taped for cable. And, you know, we have a great guest today, but there might be some kind of what we would call about me questions that come up. So if you have something personal or that relates to some experience you've had recently with COVID that you'd like to ask a question about, just keep in mind that this is being recorded for cable, and that by asking your question, you know, you're kind of giving us the answer to that in a public way. So just keep that in mind. Sometimes the about me questions, if you're willing to ask them, are the most helpful to other people because they're also having those same questions.
I'll just keep my big mouth shut.
Jerry. So we're very fortunate to have Trish Fisher with us today. I think Trish has been with the Board of Health here in Walpole as the public health nurse for just about a year. Is that right, Trish?
That's right. Yep.
Yeah. And Trish is a great person to bounce ideas off of. She's been a tremendous help and assistance to the town at this time. She's been doing a lot of the contact tracing, and I'm really, really grateful that you could take a little time out of your day to do this with us. I think you might have questions, guys, about, you know, what all this COVID has meant for the role of the public health nurse here in town. Maybe questions about contact tracing and that process that they're doing for monitoring people who are positive. But I'll give you the floor, Trish, to kind of give us an update. Thank you so much.
Sure. Well, thank you for having me. Again, I'm Trish Fisher. I'm the public health nurse here in Walpole. So primarily, my job since about March has revolved completely around COVID-19. Tracking cases and getting ideas. You know, basically it was my job to touch base with everybody that came across my desk as a positive. The way the process works is I would get notified directly from the Department of Public Health. It's all through a completely confidential system. I'm bound by HIPAA. Any information I get for any resident that tested positive, I would be given their contact information, and primarily I would be reaching out, get an idea of symptoms. That's how through all this whole process, we were able to kind of really define more of what COVID symptoms were. That's how we got new ones, like if you had a loss of taste or a loss of smell. It's all from the investigation work that all the local Board of Healths were doing. And then I usually symptoms number one, but then the biggest thing is the contact tracing. Just one way that we're trying to desperately slow the spread is getting a hold of any contacts of any of our positive cases, and I would reach out to them. Again, complete confidentiality. I wouldn't disclose names, addresses, just that you had been in contact with somebody that was a positive case. And I review quarantine and isolation guidelines, review symptoms to watch out for. And I feel that people that I've talked to over the past 3 months have just been extremely positive with working with me and collaborating. And I think it's helped as far as in Walpole as a community. We've had a total now of since March, 254 cases. Followed through them all. The past couple of weeks, we've had a lull where I haven't had any new cases, which has been phenomenal. Recently, over the past week or so, I've gotten another 4 cases in, but again, just being able to touch base with people and go through the whole interviewing process, it's been phenomenal. People are really anxious to do what's needed of them. And I feel, again, for our community, it's really been so beneficial to stop that spread. The biggest thing, is just explaining to people that when you do test positive, keeping yourself isolated, keeping yourself, even if it's within your own home, and having family members, friends that you may have come in contact with, be aware of kind of the wide range of symptoms that COVID can unfortunately present. And now, especially because testing is a lot more readily available, that's really helped. If anybody's even the slightest bit, nervous about exposure, nervous about symptoms that they are having, testing is available. And again, everything comes through the primary care doctors. It goes through the state lab reporting system. And that's how ultimately I get notified. But again, it's when the numbers were really starting to grow, it was getting a little out of the hands of some of the local board of health, because as for Walpole, I'm the only public health nurse, so it gets a little overwhelming. We were able to enlist 3 of our school nurses to go through a quick brief training. They also helped me do a lot of the phone calls. And then the state of the Commonwealth of Massachusetts actually created a COVID-19 community tracing program. So those are all volunteers that are trained through the state of Massachusetts, and they do a lot of the contact tracing. So if our numbers got beyond what myself and the school nurses could handle, because it's quite a lot of phone calls to the initial case and all their contacts, we could reach out to the state, and they have the specific team that would help with all of the contact tracing. And again, doing the exact same thing that us nurses were doing. It was just, keeping track of symptoms, reviewing isolation guidelines, and then just getting a hold of any contacts, again, just to kind of minimize any sort of additional spread. So that's pretty much how our whole process has been going. It's constantly changing as we continue to get more information. CDC, we follow different CDC guidances. DPH would provide us with all sorts of different guidances. So what they told us to do in March is completely different than what they're telling us to do now, now that we're in July. But it's been a pretty phenomenal process to be a part of. And I'm happy to answer any questions, any clarification that you might have about it.
Were there any questions submitted in advance?
No, we didn't receive anything in advance.
Anyone here in this Zoom call have specific questions for Trish about contact tracing or isolation guidelines, quarantining?
Trish, I'd like to ask you maybe a combination of 2 questions, because
Sure.
I'm somewhat bothered by both questions. The first one is when I watch the news, like at 6 o'clock, and they show like all the different beaches in Florida, it's like huge amounts of groups of people. And what bothers me is that when people go to the beaches, there's not a whole lot of people wear masks. And they keep saying, well, everybody should wear a mask because that's where all the disease comes from. It's from people breathing out of their mouth, and it spreads from one person to the next person, because then the next person is breathing in what this person is breathing out. So I'm a little confused as to what's right and what's wrong. That people go to the beach, why aren't they wearing a mask?
We, of course, our biggest advice is to everybody is to be wearing the masks. What we're finding is really hard is the enforcement of it. Being able to go out, I mean, we can't unfortunately force people. It has to be, under their own goodwill that they're willing to wear it. But again, what I don't think people are remembering is the mask isn't only protecting yourself, it's also protecting the people around you. You're feeling that you're not sick, but it's the tricky thing with COVID-19 is that we've had positive cases that have had absolutely no symptoms. That's what's hard. Some people can be a carrier of COVID-19 and not even realize it, and you're then spreading it by not using precautions like wearing a mask, keeping socially distant. That's one of the concerns even in Massachusetts after we had a lot of the protests going on in the city, people wearing masks, not wearing masks. We were really worried that 2-week time frame afterwards, because they say that you can develop COVID-19 up to 14 days after exposure. So we were really kind of worried that our numbers in Massachusetts alone would really start to spike. So we're noticing quite a bit of fluctuation, especially now with the summertime, people wanting to get out more. What's hard, like I said, is the enforcement of it. It's the enforcement of wearing those masks for such large groups of people. Unfortunately, a lot of it is the common sense, and a lot of it is people that feel that it's just not necessary. But unfortunately, it is fun on both sides. As I said, you're protecting yourself and other people around you.
In the same vein, I went to the Canton Village Mall, and I saw two gentlemen just walking, no mask on. See, well, okay, I have to wear a mask, but John Doe over here is not wearing a mask. And that really bothers me.
That's been a huge challenge. It really has been, even with establishments in town or going to the grocery store. It's you know, it's really been such a challenge to get people to be wearing their masks, to wearing it appropriately across, covering their nose and their mouth, not just kind of here, or and you know, using it, especially if they're not able to maintain that social distancing, that 6 feet away from people. It's going into establishments, outside of establishments, you know, walking, as you say. If they're household members, we don't necessarily, they're not required. Well, they're always required, but if they're household members, the exposure is already there, you know, as far as wearing masks together. But what's hard is, again, it's the outside things. If you're doing any sort of recreational things outside, still having that mask available, being able to wear it. And it's frustrating trying to take so many precautions. And it's frustrating to me as well, because I spend so many hours talking about prevention. And then when I see people out and about not wearing a mask or any sort of face covering, it's a very simple precautionary measure to take. And it's absolutely, I agree, it's frustrating when you see people not taking those measures to stay safe.
I wanted to get a haircut. And then because I'm wearing a mask, she said, no, they can't cut beards. And she says, no, that according to the governor and everything, that they, because you can't take your mask off, so they can't shorten down beards or many things.
That's true. Unfortunately, still right now with their guidance, they want those masks to stay on. That's pretty close contact. And I know, so unfortunately, the beard's going to have to wait a little while longer till at least we can lighten that up.
If it gets down to here, I'm going to just tangle it up and make it look like a cigar. My other question is last week the governor had, I guess they posted, I don't know, maybe in about a month or so, phase 4. What's going to open in phase 4, and they were showing like a lot of different, like gyms, schools, and just different places that are opening under phase 4. What I did not see is anything about senior centers. Now, my idea is I was hoping that senior centers would open, I would say in my estimation, say like in September. But now, because like they're talking about a second wave coming through, and they're also talking here like what can kill the disease and how many more cases are coming through, I really don't see these senior centers opening now until, if we're lucky, maybe till about the end of October or November.
Let me address that for you, Jerry. While I can't give any real specific information about dates or what it'll look like, I just want to emphasize, like we have been all along, that it's not going to look the same at all. People will probably have to pre-register for something to even walk in the door so that we can keep the numbers to within a specific guideline. Some senior centers are looking at 25% capacity. I think it's something we'd have to work with the Board of Health on to determine how many people can be in each space. We also are the food kind of in the food operations right now for the community food pantry. So we don't have a lot of space to have people inside right now anyway. I think it's more likely that we'll start really, really slowly, and it'll be very different, but just continue to be patient while we work out the details. We want to get you guys back into some sense of routine as well, but we want to do it in the safest way that we can. And having people inside right now, correct me if I'm wrong, Trish, seems to be the most risk we could put you in is indoors.
Right. The more we can do outdoors is definitely, you know, safer of the two. Indoors activity is just so restricted at this point. That's what's tough. Again, and, you know, then we're the exposure of, you know, more people, and yeah, it's just so many restrictions still.
We don't want anyone to get sick here at the senior center. And you're the most vulnerable population. Our average age is, you know, into the 80s. They're most at risk group of people. And we know you're missing us. We're missing you. You're feeling isolated and out there, even if you're not alone. I'm sure we're all kind of going a little crazy at home, not being able to do the things that we enjoy. But it's to keep you safe. And I'm glad that, you know, you're thinking about it. You have to have something to look forward to through all of this. And if thinking about that, being open helps to get you through day to day, to know that we're working on it and that we're invested in getting you guys back to some sort of a routine that involves us. Again, if that helps you guys cope, please know we're working on it. We are. I want to bring it back a little bit to Trish and you know, what she's been doing. In your newsletter, we've been putting this answer the call every month since they started this. So if you do get a call from a number you don't recognize, you know, they've got the numbers listed here in the newsletter. If somebody's reaching you from this number, it's probably a contact tracer trying to reach out to you. So make sure you do that. And it's next to a how to wear a mask kind of guideline as well.
Carrie, I just had a question to go back to the contact tracing. I've heard so many different opinions as to how you can catch this virus. From your perspective, and when you're doing your contact tracing, what constitutes a contact?
And they have very specific kind of outline as far as what they consider a close contact. So let me just pull up my little paper so I say it correctly, which I'm constant, as much as I've been doing this, I'm always still just double checking and rereading everything. For our close contacts, they're defining it as being less than 6 feet from a confirmed diagnosed COVID-19 person. And that time frame is at least for 10 to 15 minutes. So, and that's while the person actually actively had symptoms. So whether they started to feel ill, they weren't quite feeling right, fever, chills, cold symptoms, while they're currently having any sort of those symptoms and your close contact less than 6 feet away, longer than 10 to 15 minutes, they're considering that a close contact. They're also saying now that you can be risking to expose people 48 hours, 2 full days before your symptoms fully develop. So what we're doing for contact tracing is if your symptoms are starting on the 5th, we're going back 2 days to say, okay, where were you 2 days ago? Not just if you were out with a mask and not near anybody, but anybody, if you had visited family, you know, giving them nice big, you know, hugs and sitting all close together around the dining room table, no mask, things like that. Those are all the people. Then I take down their contact information. They're all considered close contacts. The other thing is some people, as I said, don't necessarily have symptoms. If they are known to be in contact with a positive case, oftentimes I recommend them getting tested. Their test may come back positive. They don't have symptoms. So what I do is I go off of that test date. to say, okay, you were tested on, you know, the 2nd. So as of the 2nd, who were you in contact with? And then those are a completely another group that I'll then reach out to, review symptoms, let them know, you know, really recommend you getting tested, whether or not you're developing symptoms, you're a close contact. What's gets a little tricky is people that are contacts to a contact. So if you were a first contact, you're the one that's had close proximity, you know, interaction with a positive, confirmed positive COVID-19 case. But let's say, you know, you're still in isolation, you haven't had any symptoms develop. If you've been in touch, you know, in contact with somebody else, it's kind of like twice removed. A contact of a contact doesn't necessarily need to be quarantined and isolated. We're really just focusing on those primary contacts. So it gets a little confusing. I've always kind of been erring on the side of caution, you know, anybody that you know of my contacts, just to be open and aware to any family members, anybody they may have, you know, be close with, just so everybody's a little more vigilant. I've been a little more, as I said, a little conservative with my contact tracing, just to try to contain it as much as possible, which is almost impossible because sometimes those lists are several pages long. A lot of people to call and interview and go through. Some are fairly short because a lot of people have been working from home. You know, the stay-at-home orders really did just a phenomenal job of containment, so that's made it a lot easier. And again, and then our time frame for our people on quarantine that are the contacts of a positive case is 14 days. So even if they get tested within that 14-day period and it comes back negative, we still are requiring 14 days because it's from day 0 to 14, you can be developing symptoms. So you might test negative on day 3, but you might still start with symptoms, you know, day 7 or 8. So it's tough. It's 2 weeks being isolated, quarantined in your house, place of residence. So it's difficult for people, but it's just so essential for stopping that spread. It really is. It's made a tremendous difference.
So if somebody, if I understand you correctly, within those, so say if I got sick tomorrow, for the past 48 hours, I know, sorry, no, I'm knocking. But if I went to Stop and Shop yesterday, I wore my mask, but I was at Stop and Shop, you wouldn't have to contact them per se. That would be still considered a safe activity and that I wouldn't be transmitting anything.
Exactly. Okay. So it's different for employees. So if there's an employee that gets sick, let's say that, you know, a store, because they're there for such a long time, it takes a little bit more in-depth investigation to make sure that, you know, where they were working, their masks were always being worn or not being worn, you know, how much contact they had with consumers, that sort of a thing. So knock on wood, we haven't had to go that route yet, but but it just opens up a completely different investigative mindset, basically. But nope, exactly. That's why it's so imperative, just wearing the mask every time you can, and keeping your distance when not all possible. It's crucial.
I have one more question too, about temperature checking. You know, there's been a little bit of a debate whether that is a good diagnostic or, you know, risk kind of tool. What is the stance now saying? Is that helpful or not? Advisable or not?
So it's up to each facility. Whether, you know, again, a lot of doctors' offices, hospitals, whatnot, are still doing the temperature checks. However, I believe what they were finding is that people in general, their temperatures vary so much, their normal temperatures vary. So if they had a low-grade fever, which could be their norm, it was just too much variation as far as different temperature taking techniques, different ways that different types of thermometers that were being used. So it almost basically started to cause a lot more confusion, a lot more gray areas, so that they are not mandating those temperature checks. They're still recommended, but they're not mandating it. And as I said, it's each facility that is kind of making their own decision on that one, but primarily going by recent symptoms, recent travel, and any known contacts, any known contact, I guess you could say, to positive COVID-19 cases primarily is what they've been focusing on. Again, I believe that temperature checks are still worthwhile. I think it's worth it if you have a pretty controlled way of performing them. But again, they just kind of took out that mandate. Still recommended. I would recommend it. it's
Very
tough,
helpful.
tough call.
Maybe about a month ago, and I had to see like another doctor. So when I went to my health center, and just as I go into the door, and before I even got through the second door, and these two girls are sitting there, and they have like this little temperature gauge, and you just go across your forehead. So, and they said, okay, I'm fine, that I don't have a temperature. 2 weeks ago, I went to see my regular doctor. So I was expecting these two girls to take us and go across. No, that's not what happened. That they had this, I didn't want to say huge, but like a normal size stand. And all you had to do was put your hand about this close to the machine on the side of it. It reads your temperature, and then, okay, you're good, and you go through. Yesterday, I was expecting that same thing, that I would have to put my hand up, and no, that wasn't there either. So I said, okay. So these two girls had, it's like a camera. It looks like a camera, but actually what it does, it reads your temperature. And I don't know if it goes across the forehead or how it works, but this little camera reads your temperature, and it's just a small little device on a tripod, and it reads your temperature. Okay, you're good. Go ahead. The next time I go, I don't know what the technology is going to be the next time.
It's true, and that's what I think they've been trying to really refine is the best way to check somebody's core body temperature. I know a lot of recommendations as well as just knowing yourself. If you have a thermometer you've always used at home and you know your regular temperature, we're relying a lot on people doing the self-checks as far as, if you've been feeling feverish or chills and things like that. Again, because that's a little more controlled. Your body, your normal temperature, when you're starting to feel a little under the weather. Again, because I know it's some of the facilities, doctors' offices and whatnot, there's just too many variables. The batteries start running low. Different nurses take temperatures different ways. It's amazing what they're trying to do now to do a lot more like the infrared body temperature checks, things like that. It's pretty amazing.
It's the new normal.
Yep. I guess so.
Are there any other questions for Trish? We've kept her for a bit here. I want to be mindful. She's got lots of work to do. And I just want to thank you, Trish, you and the school nurses and everyone who's helped with the contact tracing. And I'm sure it's been an effective way to help flatten the curve. So just thank you for the hours and hours of time you've put in.
Thank you, Carrie. Thank you so much for having me as well. And I'm always available. Questions that come up, different scenarios, we're constantly playing through different any kind of environments that happen to come up. We're doing it on a daily basis, so we're always willing to talk through anything with you.
Thanks so much, Trish.
I tell you that you have been very interesting to listen to, and
thank you.
Just, hear with all your knowledge and everything. That it's been a real pleasure for me. I can't talk for everybody else, but it's been a real pleasure for me just to hear.
Thank you, Terry. I appreciate that.
Thank you, Trish.
Thanks
All right,
so
thank
much,
you,
Trish.
everybody.
Have a great
Take care.
day.
Bye.
Bye-bye.
Bye.
Bye, everyone.